So welcome everyone, and thank you for joining us today for our question and expert session. So my name is Bakun Adebembo, and I'm the Manager of Operations at the CBCN Canadian Breast Cancer Network. Before we get started, I'll just like to go over a couple of housekeeping rules. So the session is being recorded and it's going to be available on our website for anyone who might have missed it. I'll post the link in the chat, and you'll also receive an email after the survey whenever the video is available. And on that link, you'd also be able to find previously recorded webinars that address a variety of breast cancer related topics. I'd like to extend our sincere appreciation to our sponsors for this event, our gold sponsor, Novartis, silver sponsor, Pfizer and Viatris, and our bronze sponsors, AstraZeneca and Roche. Our question and expert sessions are strictly dedicated to answering your questions, so there will be no presentation from our speaker, and she'll be answering questions live from participants, along with the ones that have been submitted in advance. So you can use the Q&A button. It's going to be either at the bottom or the side of your screen, and submit your questions there. We'll aim to take as many questions as we can throughout the session. And I'd like to welcome our host for the session, Kathy Amandaleo, who's also the board chair of the Canadian Breast Cancer Network.
Thanks, Bakun. Welcome again, everyone. Thank you for joining us. I'm pleased to welcome Dr. Karen Fergus, who is joining us to answer your questions about your mental health after a breast cancer diagnosis. Dr. Karen Fergus is a clinical psychologist and associate professor with the Department of Psychology at York. She is cross-appointed at Sunnybrook Health Sciences Centre in the Odette Cancer Centre, where she has been practicing as a clinician and researcher for 25 years. Much of her research has focused specifically on the psychosocial adjustment of women with breast cancer and their families. Thank you, Dr. Fergus. Thank you for joining us this afternoon. It's wonderful to have you. Welcome.
Thank you, Kathy. It's a pleasure to be here. Thanks for the invitation.
So while we wait for participants to start submitting questions, we're going to start with a couple of the questions that were submitted in advance. So one of the questions that we have here reads, the following question is about resources. There is a book called Wherever You Go, There You Are by Jon Kabat-Zinn. I love this book and give a copy to everyone I know who is newly diagnosed. Have you heard about it? Are you able to comment on it, or on the other resources that you think are a must for breast cancer patients?
That's a great question, a great opener of a question. And Jon Kabat-Zinn's book, Wherever You Go, There You Are, is a classic in the field of what we call mindfulness-based stress reduction. And for those of you who don't know, Jon Kabat-Zinn had established a stress reduction clinic in a hospital in Massachusetts way back in the 70s, I think it was. And basically he imported mindfulness meditation or meditation practices from the Buddhist tradition, as applied though to and adapted to working with individuals with medical illness in a stress reduction clinic that was operating out of a hospital. And so, of course, we know how that story unfolded. It became applicable to all range of issues and stressful circumstances, including cancer. So in addition to that, I guess what I think of as a seminal read, I would add to that a book that was written by my colleagues in Alberta, actually, Linda Carlson and Michael Specka, called The Mindfulness-Based Cancer Recovery. So this is adapting many of those principles that Jon Kabat-Zinn would have spoken about in that book, but specifically to issues that that people who have been through cancer and cancer treatment face. And so I think that's a really great option. And I would direct you there if you're interested in mindfulness-based stress reduction in particular. There's also a couple of other really good reads. And I'm also wondering, Bakun, if I have the ability to paste anything in the chat room.
Yeah,
because I do
you should be able to, yeah.
Okay, so I'll be posting some other additional books, 3 more that I just want to speak to, and I'm just trying to gauge maybe meet some of the issues in the audience today, or with the audience today. So the first one was written by a surgeon who has had breast cancer herself. It's called The Complete Guide to Breast Cancer: How to Feel Empowered and Take Control. There's also a good book by a younger woman who's been through breast cancer, named by Alice Fergus, Life, Lemons and Melons. And again, has been well reviewed, and I think for a subgroup of women who are relatively young, who are not in their 50s, which is the average age of diagnosis, that might be a good read. And lastly, Picking Up the Pieces: Moving Forward After Surviving Cancer, which is a general book, but more about that, what we think of as the post-treatment juncture. And I'm just going to put it in the chat room. Yeah. Oh, there you go. There's a few.
Yes, I have 3 of them. I just missed that first one that you said. Oh, perfect.
Yeah, they're there. So
Oh, perfect.
yeah, there you go.
Great. So I'm going to ask you a question around this reading material and information. There are those who cannot focus and say, I'm going to read this book and see if I can find something for me. Because A, it tells them that they're reading about a diagnosis that they're afraid of. And B, to have a mind that, it's not for everybody to say, I'm going to read this book. It's scary. It takes a lot of energy, and it takes a lot of discipline to be able to read something about the fear that you're feeling. Like I said, not everybody is that fearful, but there are those who cannot adapt to a book or reading material because it counteracts of helping them versus them. It makes them more anxious. What do we do with patients like this?
Right. So it's basically feeling so overwhelmed that even the thought of addressing cancer directly, or even taking in a lot of information to the degree that's in a book, would interfere with. And so, I mean, I think there's another way of thinking about that, which is avoiding what's most painful or frightening. And in a way, when you read a book, you're kind of confronting that, right? Avoidance. And so maybe, like you're saying, Kathy, people aren't necessarily ready for that. In which case, I would also suggest or think about, and I will be posting, I have some other resources, but more like tip sheets and strategies, and sort of easier to digest ways of accessing support, and maybe doing that in incremental ways, so that once you feel a little bit more in control, you have a little bit more better able to manage your anxiety, then you might feel more receptive to or more able to read a full book. But to also bear in mind, a lot of these resources that I'll be sharing today have been written in a very kind of colloquial way to make them as accessible as possible. But just as a quick example, and I should mention this because I know this is a Canada-wide broadcast, but Ontario, the Cancer Care Ontario Health Cancer Care Ontario, it's called. I apologize in advance because much of my responses will be Ontario-centric because I live in Toronto. But they have accessible to the world, but including across Canada, a number of what we call self-management guides in relation to anxiety, depression. There's one for fatigue as well. And I would direct you to their website and to those guides, because again, they give you that little bits of information that can be helpful and digestible. But as a first step, I think is kind of what you're saying, that if you need a first step to kind of open that door, and maybe sometimes it is a bit scary, and it is like a box, of not knowing what will come out. I think there are lighter or less intensive ways to expose oneself to the material that would be helpful in terms of aiding your coping.
Great, thank you. So the next question is, I'm on anxiety medication already. I have stage 4 breast cancer, and with each new treatment, I find I have an increasing anxiety and trouble sleeping. how do I discuss this with my oncologist? I guess she wants to know how to discuss it without taking up so much space and time at her appointment.
That's a great question. Yeah. So first of all, it's very understandable that with each transition to a new treatment, that there would be a spike in distress or anxiety and worry. It may be related to not knowing how this new treatment will impact one's body, or also wondering how well this next treatment is going to work. And so I agree. I think sometimes it's a concern for there's only so much time, and you've been sitting in the waiting area knowing that there's many other people like yourself who may be already being seen late, and you're feeling rushed and all those things when you go into that crucial appointment. I would first of all just say, if that's what's behind the afraid to ask, I would again grant yourself the permission. It's not your job to fix the backlog. And it's really crucial that you have all your questions answered. So just to say that if that's at play there. But also some people are intimidated, or they just don't want to, admit to having trouble either on that emotional side of things, or difficulty with sleeping, or sleep disturbances and disruption. And so again, I would suggest just don't be afraid to raise it. A lot of oncologists will not, and that won't be news to them. I think they'll have worked with a number of patients who will have expressed similar struggles. And also they understand that you need all the energy that you have to get through the treatments themselves. So they want to support you in being well rested. And so oncologists might offer medication, like a short-term psychopharmacology, like a psychopharmacotherapy, like an anti-anxiety medication, if you're open to that. Or they might refer you to a psychosocial oncologist within the hospital. But then again, everybody should know about resources like Gilda's Club and Wellspring in the various provinces, or you'll have another similar kind of community-based support center. And one of the silver linings with COVID has been that it's forced everyone who runs Wellsprings and Gilda's Clubs in Canada to transition to delivering their programs online. And these transitional programs that have been offered online, we know have been extraordinarily successful. So even though now a lot of in-person programming is resumed, there are many programs that have remained online and remain very accessible. So I strongly encourage folks who are attending today to, if you haven't already tapped into those resources in your community, just do a quick Google search. And those programs will help to teach you coping skills and relaxation and meditation, as we were talking about earlier. And those are one step towards, if you can start to quell your anxiety, that's one step towards helping with sleep. I also have a couple of additional resources in relation to sleep in particular. And these are general books and workbooks that have been offered, in general, but that can certainly be, everyday worry is what keeps us up at night, whether it's about cancer or anything else. So I'm just going to paste these here as well. Mm-hmm. Now, they basically have to do with strategies to develop better sleeping habits and to get better sleep. And then I also point out that in the discussion, or in the chat room here, I've just posted something called insomniafree.com. I stumbled upon this years ago. It's a woman who struggled with insomnia herself, again, not necessarily related to breast cancer, but wonderful, free, like she's doing the world a great service, I think, because she's offered such amazing tips and tools. She draws on cognitive behavioral therapy strategies, but also, and she has like little programs that you can walk yourself through. So again, another excellent resource to enhance your sleep and reduce your ultimately fatigue.
Great, thank you. I guess the question also comes from a space where somebody is going to visit their oncologist and there's so much going on, making sure the medication is working, what next to do, and then the vulnerability of explaining to the doctor as well that you are having trouble sleeping, feeling anxious, and those are two parts, right? So the oncologist is dealing with the medical aspect of it and making sure everything is going well. And then you also have the additional load of the mental issue while you're going through this. So it's a big question, and I can understand how the anxiety is out there, and it's confusing to a lot of patients. We're going to move on with Bakun's questions now. She must have some from the live audience.
For sure, yeah. So this one's kind of related to the last one. So it's a person that's also dealing with a metastatic diagnosis. And their focus is more on just like living with uncertainty. So do you have any strategies for that? So this isn't necessarily like discussing it only with like the, their oncologist, but that could be one, but just general strategies in living with that uncertainty that comes with a stage 4 diagnosis.
Yeah, wow, that's such a big question. My mind automatically goes to a colleague of mine, Mark Katz in Ontario. He uses this wonderful analogy. I think I've spoken of it before, maybe even within the CBCN group, but it has to do with this invisible cloud of uncertainty that we carry with us wherever we go, and everyone does if you're mortal. And yet it's invisible to us unless we've been affected in some way by something like cancer that challenges that. It sort of gives us those glasses to see that invisible cloud with. And so sometimes it can be helpful to what I'm suggesting right now is more of a shifting or reframing approach, where you take your concern with living with uncertainty and reframe it as, this is something that we as human beings are always subject to, but we're not necessarily aware of that. And so I think that just that simple reframe of recognizing this is not just happening only to me, but it's a state of the human condition. I do think that that can be a little bit, at least in the short term, alleviating. The other just general point I would raise is that even within the realm of uncertainty, there are certain things that we have control over. It might be very immediate in our immediate sphere, but I think it's very important when there is a lot of uncertainty to pay attention to those things that we can assert control over and that are certain. If you have a special person in your life who is always there for you and willing to go for a coffee or have a chat with you, or someone you can express that to, make use of that. Don't leave it or keep it in sort of out in the wings and just live with the fears and the uncertainties. Exercise what can be made certain. And then that could be as simple or functional as like making yourself a nice meal if you're feeling up to that, something that's nourishing and healthful. And again, that's an example of a certainty amidst other uncertainties. And so again, there's just some ways to handle that living with the unknown is what I think what you're describing.
Mm-hmm. Perfect. And then another question that we have from the live audience, they want to know how they would deal with the fear of germs when they're going through chemo and having children. So just dealing with germs that comes with treatments, basically.
Yeah, that's a very interesting topic. I have to say it's not really my area of expertise. So what I would say is very similar to what another friend or layperson might say. But I guess I would just say that maybe the best thing to do would be to talk about this with your physician, your family doctor. Even you don't have to go to your oncologist, but how to develop good hygiene practice. My nursing colleagues are awesome at reducing risk through excellent hygiene practices and what to recommend. I mean, now that we've all been through a pandemic, I think we're a little bit more up to speed on that in general. But unfortunately, I don't have the perfect sort of solution for that, because I can appreciate with youngsters around the house that there are more germs floating around, and that would be something that I think is important to speak with a professional around, like how to work with that. It may in fact involve better ventilation and wearing masks and things like that. But again, I would suggest speaking with a medical professional or a nursing professional about it.
For sure.
I guess I would add to that it's not only that the idea of preventing germs making you ill, but it's also the anxiety of what's too much fear
Mhm.
to be around kids or people that come in, that they're going to introduce something to you that you're going to be, put in a very serious situation. Because even during COVID, we saw that some people take it to an extreme and some others don't. So I guess if you're impacted with the diagnoses, and then you say, okay, I've got to protect myself, where's the level of anxiety that becomes a little bit excessive,
Yeah,
perhaps?
yeah, I think that's a really good point, Kathy. Like, really, there's realistic concerns, and then there's ones that may be more elevated than necessary. And, I think it's always good to have folks in our lives who are reality testers for us,
Yeah.
and who you can actually turn to and just say, like, is this reasonable to you?
Mhm.
Maybe as well, if you're doubting that, if you think there might be the risk that you're exaggerating the risk.
Yeah, yeah. So I'll go ahead and do some more pre-submitted.
Yeah, for sure. Go ahead.
Okay. Another question. I felt very alone and isolated during my breast cancer diagnoses and treatments. Do you have any suggestions for managing the stress of breast cancer when a husband and other family relatives do not offer any emotional or physical support?
Okay, yeah. So first of all, I'm just sorry to hear this individual is finding themselves in this position. But unfortunately, for a lot of people, and friends and family don't always know what to say or how to be helpful, even in the best of relationship circumstances. And so, in terms of social support, there are really two directions that one can go in, and they're not mutually exclusive. So you can go in both directions. One is to mobilize your existing support network or your support circle, and or to add or build on your supports by meeting new people. And by that I mean many breast cancer patients often find it hard to relate to others who haven't been through cancer themselves, and especially when the diagnosis is new or fresh. So it can often be very helpful to connect with other women who've either already been through breast cancer treatment or are going through cancer treatment. And those ones who've already been through it, they're kind of like they're the role models or the mentors who can, it's always sort of nice to have those folks who are traveled a little bit ahead of us. But also the support groups are great for this because they're safe spaces to share and discuss your concerns and learn from others. And they're often professionally facilitated. In that case, the facilitator will try to make sure the discussion stays on track, and also that all folks who wish to speak have an opportunity to speak and to be heard. So it's good to attend moderated support groups, I would say. On that topic of, how family relationships change during cancer, and again, I'm just thinking, Kathy, of your comment earlier about some people don't want to do the whole shabam and go to a full support group. The Canadian Cancer Society as another wonderful resource. They've got excellent print material, but delivered in accessible, digestible ways. And so I would encourage folks to check out that. I can post one link that I have here that is on this topic of family. And also, I just want to pick up on that phrase, when family and relatives do not offer, which came from the question, but that really stood out for me, because I think a lot of us want to believe that those who are closest to us will know exactly how to be helpful when we're in a crisis, without any coaching or advising or specifying, etc. But I actually think we have to remember that breast cancer is often new territory for the whole family or the couple or a friendship, for example. So although one person is the identified patient, the woman with breast cancer, that's the patient, the whole family circle or the whole friendship circle or network is also going through that experience. And it's important, therefore, to not be afraid as the patient to be specific about your needs once you become clearer about what those are. And I would caution people around not anticipate or expecting, or even having implicit expectations that those close to you will know exactly what you need, even though they might be very versed in what you need. under normal circumstances, under just everyday challenges and life hassles and stressors. So I'm just going to post one of those links with the Canadian Cancer Society there, because I did find it quite useful. It's just nice to think about different ways of thinking about how folks can support us, but also giving us a little bit of a window into what carers are going through as well.
Perfect.
Yeah,
So I just want to say the links that you've been posting, it was just going to just the host and panelists. So if you'll notice, I'm reposting it to everyone. So you can just right at the top where it says to, you can switch it to everyone. That way, when you post it, they should be able to see it.
Oh, I see that now. Okay.
No worries.
Oh, actually, you know what's interesting? I only have the ability to post to you or Kathy and not everyone.
Okay, then just post it and then I'll repost it.
Okay. Yeah, sorry.
Yeah, so keeping back to this question, I also wanted to make a comment that usually the woman is the driver. Once you get that diagnosis, unfortunately, you tend to want to make everything as normal as possible. So the loved ones around you pick up cues. And if they feel that they don't have to do much because you're in control and doing well, then they kind of like say, okay, there's not much for me here to do. And thank God, because I wouldn't know what to do, or it's hard for me to even think of what I can do. So I can understand how some women and patients become very much the driver of this whole family diagnoses. And the other thing is that these things linger in patients' mind for a long time, and they go back to it even years later, say, when I was diagnosed, I didn't get the support that I needed. So there's also room for individuals to start addressing it as early as possible, so that it doesn't make them feel down when they're feeling down, thinking about recurrence and such events that are forever lasting.
Mm-hmm. No, you actually raise a really good points, Kathy. I'm not sure if this is where you were going to, but getting back to this idea also of the woman often being the driver in many ways. And I think that that's so true. And I think a lot of women struggle with loss of independence.
Yeah.
And being a little bit more dependent on others. And that can also interfere with directly expressing your needs and in this particular circumstance. So thank you for raising that, because that is I think that's a socialization, how women are socialized to be the carers and then to be the recipients of care, I think can be quite a challenge.
Yeah, and it's a balance for these women, because you're on the one hand, you want to be, you are the driver, but the other hand is like, I wish I wasn't the driver, and somebody take over and please do it all for me. So it's a lot. It's a lot of thoughts and a lot of fear and a lot of confusion. But that's why we're here. So I'm going to move on to the next question. It reads, I'm having trouble with letting go of anger. I'm angry that my body betrayed me, angry that the treatments are so invasive and disfiguring, angry that after all this money raised for research, we are still treating cancer in this barbaric way. How do I deal and cope with this?
So thank you for your honesty, whoever submitted this question. I think you've just basically spoken to many of the harsh realities that come with the breast cancer diagnosis and the treatments. And anger is a justifiable reaction to have, and anger can sometimes be energizing and empowering, right? But too much anger can turn in on itself or involute to the point that the person being most negatively affected by that anger is oneself. So when one is feeling overwhelmed by anger, I think it's important to ask oneself, is this anger constructive or destructive? And I say this even as thinking that sometimes anger initially can be quite constructive, but then kind of become a little tainted or become more destructive than it was originally constructive. And so one thing I suggest doing is asking yourself this question: is my anger motivating me in good, positive, life-affirming ways? Because that is definitely a possibility. Or is it corrosive and coloring my perspective to the point that it's interfering with my quality of life? Mm-hmm. And if your answer is the latter, that's not helpful, it's not healthy. That is what we think of in psychology as what we call secondary anger, which can be maladaptive. So with secondary anger, it's kind of like a protective crust or bubble over a more vulnerable feeling underneath it. And it's tricky because, again, I want to make sure this individual understands I'm not suggesting that the impetus for the anger was irrational or not justified. It really originally would be, but it still can be corrosive. So I suggest if you're feeling this type of secondary anger, there's a simple question you can ask yourself, which is, in your quieter moments, to pose this question to yourself: what is beneath my anger? And just wait for that response. Is it hurt? Sometimes it may not even be a word. It might be a feeling that comes forward, but is it hurt? Is it disappointment? Is it that feeling of betrayal that you mentioned earlier in relation to feeling like your body betrayed you? How does that relate to other feelings of betrayal that I've experienced in my life? Or is this sadness, or is it loss or grief? And so the best way, of course, to go about this exploration, if you can, is to do this with a mental health professional or in a support group. But you can also do this through journaling or other forms of creative expressions, painting, dancing, drawing. By accessing those primary, deeper feelings, you still may not be able to have the underlying need addressed sufficiently. Like, yes, there are many of the treatments do seem barbaric, and you can't change that at this time. But for sure, I think having more self-awareness, because you've done a little bit of that self-exploration, will help inform you about what you can do to kind of move beyond that anger, if that makes sense.
Would you comment on the word scared? The actual word being scared. I find that lots of people are afraid to say that, I'm scared. But that's a feeling that you get when you're feeling afraid of recurrence or afraid of what might happen, or the big word, afraid of death.
Yeah.
So scared is a word that is not often used. And I think that if people allow themselves to be honest and say, I'm scared, that might be a little bit of a help to actually say it, because fear and being scared just takes over, and it causes people to become angry, confused, sometimes irrational, and sometimes uncomfortable to be around with.
Yeah, I love your use of the word scare, by the way, because I think we associate it with childhood, like it's scary, it's a scary, story, or it's scared. But the reality is our feelings don't have like ages attached to them. And it's just so freeing, I think, to go, yeah, I am scared. And I don't need to be, I shouldn't be, just because I'm an adult now, I don't need to be ashamed of that feeling. And it could be as simple as that the anger, again, very justified anger, but it's easier to accept or recognize anger, and men really can relate to this, than it is to accept scared or scary, and yet, paradoxically, by saying, yeah, I am scared, and it almost just relieves some of the tension around it, just by being able to say, yes, that's true for me.
Yeah. Thank you. Are we going to Bakun now?
Sure.
Okay.
So I think this is a question that's kind of related to what we're talking about in terms of fear, and it's one that a lot of early breast cancer patients can relate to. So how does someone who's post treatment or deal with the anxiety that comes with like that fear of recurrence? Like, how do they know if they're feeling certain aches and pains in their bodies, or seeing certain things, like that they're not over worried that, this is a recurrence and all of that? So how do they deal with that fear of recurrence and making sure they're not
in that form, right?
Exactly.
Especially, so what we think of that as hypervigilance. So you're hypervigilant to physiological cues and sensations. First of all, I just want to say it's so common, and especially just after you're close to ending treatment, and you're sort of just you're just getting your feet wet with what we call survivorship. I know that phrase is not always a welcome phrase, but it's the post-treatment period. And so, I think that I have a very concrete initial suggestion, because I know there's other questions coming forward around this fear of cancer recurrence in general.
Mhm.
But in relation to bodily sensitivity and hypervigilance, you're walking a line in terms of recognizing, first of all, that you are an embodied being. And so you're going to have, sore backs and headaches and all manner of things, and arthritic joints. And that's not necessarily related to cancer at all. And so that's part of being living. And so that's going to be a part of your experience no matter what. But the trick is, to what degree is it potentially signaling or indicative of a recurrence?
Mhm.
And I think everybody has to come to a plan of action, so to speak, and what works for you, but if it's something that's occurring, like if maybe you have a way of saying to yourself, for example, I'm going to let this just be what it is for a week or two. And, it's often the case, these things resolve because they weren't related to cancer, and you've given yourself that window to experiment and just see how things unfold. But then if you feel like, okay, this has been persistent, I do need to talk to my oncologist or my family doctor as a first step, then by all means, after that window has passed and it's still an area of concern for you, then go to ask the professional, because you don't want to sit on it either. But it is a balance, right? Because you could freak yourself out with all manner of things, right? And so I think that's one point. The other thing I would like to say is, I do think, and someone in the audience might debate this with me, but in my experience in working with individuals who've had and been through breast cancer, I do think it gets easier with the passage of time, because you get enough of these episodes under your belt. It's not a definitive, it'll never happen, but you get enough of the common headache, or the you might have a feeling of chest congestion or tightness or something, and they're attributable ultimately to something else, or it resolves itself. And so you get enough of these experiences that you're not plagued with the same kind of worry that you would have been soon after your recovery, or soon after your treatment had finished. So I think it does get sort of better with age, so to speak. But also I do think that everyone has to come up with a kind of like a package of ways of handling the hypervigilance, the bodily hypervigilance that you can get caught in. If, there's the other extreme, which would be like, I'm at my doctor's door, within minutes of that. And that's not a way to live, right? So and then of course, that's where the coping skills comes into play too, because what do you do with that 2-week period of uncertainty or whatnot, or maybe it's longer because you go for another test or something like that. So I can talk to that later as well.
Bakun, can I interject and just ask a quick question around this? So you said during time it gets easier. So I have a question around that. Let's say a woman is diagnosed like 25 years. Let's give that a number, a long time. Are there stages during that time that are different? Do you see it? Is there anything written where you say, for 5 years, you may feel this, and if 5 years go by, you feel less of this, but more of that? Or is there such milestones of how people evolve with the time as it goes on? Because for sure, people just don't forget it, even if it's 25 and 30 years. But what is that passage like in your experience and expertise?
Yeah. A phrase comes to mind. It was actually spoken to me by one of my research participants years ago, a man with prostate cancer. He said, yes, you're always sort of plagued by these fears to some degree, but he said that the print gets smaller on the page. And so I think, again, it depends also on it always depends. Like in psychology, it always depends on the individual circumstances and life events, and there's just a whole host of things. But in general, I think it does, I think you kind of develop a kind of like that feeling of bodily betrayal can become like, you can regain a confidence in your body's ability to heal and ward off, nasty illnesses. And so I do think that does come about, but it's never a perfectly, like there's always that uncertainty. Like once that veil of invisibility has been lifted around the cloud, it's always going to be there to some degree. So I would say that. The other thing I would just mention too is one thing that occurred to me was this idea of anniversaries, or I know a lot of individuals will have been told by their oncologist, right, that after 5 years, your risk of a recurrence is reduced by X number of percentages. And so I think a lot of people take that really to heart. And so if you get past that 5-year milestone, then maybe it actually does have a positive impact. But by the same token, it can work the other way, where perhaps, you have breast cancer in your family and a parent or someone who is close to you, related to you, passed away at a certain age. Sometimes it's getting to that age after your own diagnosis and recovery that things start to settle down for you. So I do think there's a lot of individuals' life circumstances and life events and that play into what I'm talking about. So it all depends, I guess, is what in short.
Bakun, go ahead.
Sure. So for some of the questions you've kind of answered and said, speak to, some of these practices, or like mindfulness practices, or it's good to speak with a professional. So how does one actually go about finding like a psychologist, or, maybe someone has tried to find a psychologist at the cancer center that they're at, but it just never goes anywhere. They can't get an interview. So is there like a database, some type of resource that like people can check that maybe isn't directly at their cancer center? Is there anything like that?
Yeah, so that's a really good question. So there are some community-based resources. So for example, I know again in Ontario, but Wellspring has locations in Alberta as well. Those centers have like 3 sessions with a mental health professional that you can access for free. So that's one thought. And the advantage to a Wellspring is that the person you speak to knows about cancer related issues and is experienced in psycho-oncology, right? So that's what I'm thinking. Definitely, if you haven't tapped into, if you are being treated at a major cancer treatment center, but you haven't even thought to access their psychosocial resources, there is a whole host of folks who are there and ready. It might be a little bit of a wait. It might be 2 to 4 weeks, for example, but you can get in to see them. And I would encourage you to make use of those resources if they exist for you. If you can afford to pay, and I know that's a big if, but even, even if it's a few sessions, and in that regard, a lot of insurance companies, the coverage will cover a good handful of sessions, like 4 to 5, with a clinical psychologist or registered psychotherapist. That is something that I would encourage. So for example, you can look up clinical health psychologist dash in your region or location, and that caveat health psychologist could, then you kind of have to do a little bit of research. That would be one way. Word of mouth. Ask around. A lot of your friends or people may have seen a really good mental health professional, and just because they may have been helped for a particular issue like depression or retirement, counseling around retirement or something like that, doesn't mean that they aren't also capable and able to work with you around cancer related issues. Or if they aren't, then somebody else. So I think word of mouth. And then, of course, every province has an association for a psychological association. So they will have a referral, what's it called? A process or way of linking people to practicing practitioners. And so if you tell the association what the issue is, they may be able to align you with some, usually 3, they'll give you 3 names of people. On that note, I would also just say, if you are going in the direction of hiring somebody, think about it like that. You actually are hiring this mental health professional to help you. And usually you'll have about a few minutes where you can actually talk to them or have that very first session. If it's doesn't feel like it's quite a good fit, you should feel able to switch or try someone new or have a few, quick conversations and just ask them the question of how do you work with somebody with my type of issue or situation, and effectively interview them a little bit. Not everyone has a ton of time to do that, but it's fair to do that, I think.
For sure.
Good point. Is it back to pre-submitted questions?
Yes, go ahead.
Okay, so this one reads, do you have strategies for planning the future? If I try to look forward, it is a blank space. I have successfully completed treatment, but the threat of recurrence is ever present. I would like to be a more active participant in my life and not feel I'm just existing, albeit quite comfortably. What steps can I take to address this?
Yeah. I would say, in a word, meaning, and I would be asking myself the question, what is most meaningful to me? And then just let yourself run with that answer. Is it family, creativity, reading, being of help to others, being of service, being a part of a community, being in or appreciating nature? So that's one point I would say, is just ask yourself, what is most meaningful to me? And so that would be the what of meaning. That's how I think about it. But then there's the how. And in relation to the how, I would ask, what gives me joy? And run with that. It could be time with my grandchildren, going for long walks, baking and sharing my baked goodies with others, visiting a relative who lives alone but appreciates your company. These concrete actions enable us to actualize what is most meaningful for us. Now, if your fears of recurrence are interfering with your capacity to engage in those things that give you meaning, I would suggest finding supports. And so I haven't quite gone here yet, but there are a number of fear of cancer recurrence group programs out there. It does take a little bit of digging. Sometimes they're offered through Wellspring or associations like Wellspring, but other times there may be a run through a hospital. You may have, and so you have to, again, depending on where you're located, look into that. When you first find yourself, there's another thing I often suggest, and this is more like a little bit of a tip, and it might apply to some of the questions that were asked earlier, but when you first find yourself feeling overwhelmed, there are some things that you can do in the moment. And the first off, it's important to practice what we call decentering, by putting a name to the pain, so to speak. So when you put a name to the pain, what you're doing is you're engaging that part of you that can step outside of the feeling by labeling it. And then you're in a better position to recenter in the moment. And I know this sounds a little bit maybe what's the word, lofty, given it's just all you're doing is labeling the feeling. But by posing the question to oneself, what am I feeling? Is it fear, worry, anxiety, scared, dread? Or it could be something surprising, like I feel really sad, or I'm feeling really frustrated. Whatever the answer is, make sure you're specific. By labeling the feeling and putting that into words, by effectively decentering, you're moving from having the emotional center of your brain activated, what we call the amygdala, or what's called the amygdala, to engaging your prefrontal cortex, or the rational part of our brains, which creates an immediate feedback loop, which actually reduces that level of intense negative feeling. So once you've decentered, named the pain, decentering is a good thing, name the pain, then take a few breaths and notice where you are in your immediate surroundings and recenter in the moment. And I know that sounds like, okay, what's that going to give me in the end? But just by doing that, and by the way, you might have to do that repeatedly, throughout your day. Just say, what am I feeling? Because I think you can relate to this even in other areas of your life. When you're sort of like a hamster on that wheel spinning with worry, it's like it's taking you away from some other feeling. And so by just saying, what am I feeling? And you sort of cut to the chase, it alleviates, the hamster doesn't have to work as hard.
And I guess it would be similar, would you agree, to the emotion is so big that it overtakes your sense of being rational and making sense of things in a more factual way, right? So if you're able to say, wait a minute, this is all emotion, or most of it is, how do I step out of it and become more clear and more objective and rationalize this fear of whatever it is? Like, I just got a bump and it's this, you're automatically going to go to the worst of the worst. And then you're going to go research, and then you're going to go, the hamster, spinning its wheel, it just starts taking over. So I guess if you're able to find a way to say, wait, let me rationalize this. What is real here, and what is the most likeliness, and how do I get myself in that gear?
Yeah. And I think the way to do that is exactly what, is labeling that. It was actually John Kabat-Zinn, going back to him, I heard him recently talk about, our minds are basically, we're never like never, but very rarely are we present, right? It's much more likely that we're that hamster. And he talks about how we're either worrying or planning most of the time.
It's true. We're in two states.
But neither of them are here.
Running around. Oh, I'm glad we could have a little bit of a laugh over this. I'm going to go to my next question, if that's okay.
Yeah.
I know anger and grief are typical after breast cancer treatment. I am experiencing both still, but right after treatment, I also felt a kind of hopeful euphoria and intensively examine my life to make it more meaningful and to create more meaningful experiences. Is that common too? Is there a name for that period or feeling? I made changes accordingly, but then those feelings faded and my life feels worse than ever before. So I guess it's that up, down, emotional upset that, you struggle with.
Yeah. This question actually, I'm not sure how many folks could relate to this. It'll be interesting to hear. And by the way, before I answer that question, I just wanted to draw your attention to that Buku just posted. Mm-hmm. Yes, there is an amazing resource in BC called Inspire Health. And for those of you who live in BC, I'm not sure if you have to live in BC in order to access the resource. It's common, by the way, if you're seeing a licensed practitioner, be it a psychologist, a registered psychotherapist, social worker, it's common that you have to see them within the province, even if it's a virtual session. So that's why some of these resources are very specifically bound by province. But Inspire Health is a really good resource if you are in BC. So just to know about that, and apologize for taking that. But getting back to this bit of a roller coaster that you described, I really like this question because it points to what I think of as this kind of pincer effect when you've been through such a hard and challenging period on a physical and emotional level, and then it's done. Mm-hmm. Then they've done the treatment, it's done. I mean, it's done eight months later or so, but let's say the active treatment period is done, and there's this initial kind of release, which one could equate with a type of freedom, if not euphoria. But once that initial burst of good feeling has passed, then there may be the question of what now? And I think that's kind of how I interpret the question. And I think it's important to remind ourselves that cancer recovery is a process. We can't exercise it. We can exercise a degree of control over the process, like you might do this questioner did by prioritizing, making self-supporting, healthful, life-affirming changes initially. But there are also aspects of the recovery process that we simply don't have control over or can't rush. And by the way, sometimes, it's called like that kind of flight into health. Sometimes those take charge activities immediately after treatment, it is a way of respectably distracting ourselves, if you will. Because I think there's this idea that you can't really get around the other piece, which is a really common thing in this, what I think of as the post-treatment juncture, which is a well-known area of elevated distress, which is there's a lot of loss and grief going on simultaneously with the physical recovery process. And so sometimes it can kind of backfire. Maybe that's what happened here as well, where although you exercised all these great, or put into place all these great things, it's kind of like the other aspects of the experience kind of caught up with you. And so I think of this as like going back to this idea that it is a process, And that, so there are two sides to the end of treatment. There's the side where we can assert influence over and be the director of our recovery journey. And then there's the other areas where we have to humble ourselves in a way and cultivate patience and be more flexible and responsive in relation to the realities that aren't within our immediate control and our own realities. What are our reactions? And we may not be feeling strong and empowered. And I know that's a mythology out there that after you've been through cancer treatment, you need to be, I think, a better, bigger, brighter person. But, sometimes, you're often not feeling like that. And so pay attention to what's real for you and honor that is what I would say.
Yeah. And I guess that we want to do something. So we want to say, oh, when I get over this, I'm going to be doing this. And you have a list of things to do, even while you're going through treatment, you're already anticipating how you're going to live, what you're going to do. But sometimes, unfortunately, I guess it lets you down because you're not getting from it what you thought you would. Because that's also a comforting and it's a therapeutic way to manage those anxiety feelings. Say, I'm going to do this and get it all in order. And women tend to be like that, I would say. So it's possible that we overstep and overthink. And then when we get let down, that it hasn't given us what we wanted to give us, you feel a little more deflated than you thought you would.
That's another, I think, very viable explanation for that phenomenon. Yeah. Like we have a fantasy of what is going to happen. Or maybe you have a role model in your life or somebody who you've seen even in the media who represents what you want or for yourself, right? And then you're not achieving that. And it's sort of like, yeah, that can be the case too.
I have one more question before we hand it over to Bakun for the live questions. The dreaded, I have an appointment, I'm going to go crazy, waiting in the waiting room and waiting for my results. How do women cope with that, or patients cope with that every year, year after year after year? They go for their mammogram and their blood test, and they wait, and they're anxious the week before, 2 weeks before, and they go nuts until they get the results. How do you alleviate that horrible anxiety? Pardon me?
They call it anxiety.
Yes, that's right. Thank you for reminding me. Scanxiety, SCANXIETY.
Any tips? Any small tips?
Yeah. I'm going to be shameful about this and just say, like, from a human perspective, this is not even like a psychologist talking, because psychologists are all about don't avoid.
Yeah.
But I think when you're in that zone of waiting for the unknown, I think there's nothing like a good distraction.
Yeah. I tell some women, just talk to somebody and let the time go by. And
yeah, exactly. Like immerse yourself in it.
She or he will be in that same situation, and you'll just comfort each other as the time.
That's a great, that's if you're actually in the waiting area. And then there's also like, there's the guilty, whatever pleasures, right? Of like something like I don't know, something that you normally wouldn't be proud of saying that you do it because it takes your mind off of it. And then there's always knitting. I've seen a lot of
That's very good. Or something to keep you busy. That's excellent. Wordle, Wordle.
Yeah, that's right. Keep the mind occupied. They're all distractions, by the way.
Yeah, exactly.
Effective.
Exactly. Bakun, I think you're next.
Sure. So I think this is one that a lot of early breast cancer patients will relate to as well. So maybe in the beginning of when you got diagnosed, you have a lot of people that are there supporting you, family and friends offering help. And then that kind of just like trails off and drops off, especially, you might hear people saying like, oh, you look good, or, you've gone past treatment, so you should be okay. So how can someone like respond to that or deal with that? Like, so the aspect of like people kind of dropping off, and then people like thinking, oh, you should be fine because you appear to look fine.
Yes, there's sort of a twofold. I think, I very simply, I would I don't mind being courteous. So if you don't like this approach, that's fine. But I think it's fair to say that most folks who make comments aren't necessarily, they aren't necessarily have a mean-spirited reason for saying it. Often they don't, but it's a moral ignorance, I guess, than anything else. And so first of all, I like to kind of preface, I appreciate, what you're saying, or thank you for inquiring, or thank you for, recognize that it's likely coming from a good place, so you can speak to that. But then there's a but to it, which is, but actually, even though I look really good right now, I'm not feeling 100%. In fact, I'm feeling more like 30% of myself, and it's been really hard. And I know that there's sort of pick and choose those moments when you do it, because of course, sometimes it's in a situation where, hi, how are you? And your reflex is to say, I'm fine, right? Or not, but then it's not really a great place to open up or talk about that, even if the person's receptive to doing that. So I think it's one thing is sort of acknowledging the likely good intention behind the comment, but then maybe if you feel comfortable stating what's real for you and true for you, not what they're trying to ascribe to you. That's one. And then what was the other part of that question? It was about
I guess like the support kind of trailing off.
yeah, so that's also like an image that one of my friends who's a 2-time breast cancer survivor says. It's like initially there's all this support, it's like a wave that comes up and it's like there and it's so nurturing and wonderful, and then exactly what you just described, it recedes, right? And so again, it's unfortunate you're feeling vulnerable, but the antidote is to be a little bit more expressive and assertive of your needs. So yes, they were there for you and offering. Now maybe they're not there for you, but they still want to be helpful, but they don't necessarily know. And there's this assumption that when your illness ends with the end of treatment. That, by the way, is really common within couples as well. And in fact, the way I think about it, I have this graph where, your illness ends, yes, your treatment period, let's say 8 months to 12 months, it ends here. But then there's this whole emotional and physical recovery period after the fact and after the treatment ends. And so many folks either want you to be the way things were, and you're still thinking about what all that's changed, or dealing with all the loss issues, everything that's happened since. So that's a really vulnerable period for all relationships that have been affected by cancer, either intimate relationships, friendships, because they don't realize, or maybe they don't want to recognize, that you're still quite vulnerable and still struggling with it. The woman herself often doesn't even realize that that's still a very vulnerable time. And that's part of this. It's dawning on me, oh my gosh, I had all these high ideas about what I'd be after treatment ended, and none of that's being realized. It's because I think we have those high expectations of ourselves.
Another question?
Yeah. And then I guess kind of related to that whole aspect of, treatment ends for early stage breast cancer, treatment ends here, but there's still like that emotional side. So how does someone balance moving forward and acceptance versus like having to work on healing those emotions and trauma?
I think the person who asked the question is, it's that word balance is a really, really, really good one. And what it makes me think of too is, when do you resume like the things that you're used to resuming? Like when do you reintroduce, other types of activities that aren't necessarily focused on coping with breast cancer, right? And that balance, how you strike that. I think I would answer that mainly by just saying it is a balance. It is a balance as you feel ready, and paying attention to what interests you, or what feels like it's the opportunity is presenting itself and it feels right now, like paying attention to I guess opportunities or desires that you have that maybe weren't as salient while you're going through treatment. Now they're starting to kind of rear their head in a good way again, and take advantage of that, because there is a kind of a reintegration into everyday life that ultimately does, I think, I want to say need to happen. I think it kind of does need to happen, where you do leave behind some of the cancer patient role in a way,
Mm.
and identity. And some women really embrace the identity of having had cancer and put it to lots of good for themselves and for others possibly. And then some folks really benefit from maybe separating a little bit from that identity. It was an identity that made sense while they were actively engaged in treatment or recovering from treatment, but now maybe not so much. So it's very individual.
Mhm. Okay. Kathy, do you want to ask some
Yeah, I just want to
questions?
ask a follow-up question. Do you think society creates our emotion in how society views a diagnosis of cancer, especially cancer diagnoses? Do you think that because often they look at you and they'll say, oh, cancer, because it's something that is not known and you don't understand it unless you've gone through it or unless you have a family member who's gone through it, because everybody wants to stay away from the cancer word or situation. Ultimately, we all face it one way or another, and some of us won't, but for the majority, we'll know somebody or face it ourselves. But do you think society has a big impact on how we relate to our emotions towards it?
Yeah, it's such a big question. So
Yeah.
the short answer would be yes.
Yeah.
I mean, you're hitting the nail on the head in terms of cancer still being very stigmatized and scary. I'll come back to that word.
Yeah.
And so I do think it plays a role in how we ourselves evaluate it or respond to it. Yeah, I just think, but I think in a word, it is still a very stigmatized. I mean, when I first started in this field, the numbers were 1 in 3 would have a diagnosis of cancer, and now it's 1 in 2. But on the other side, though, survival rates, length of time, being cancer free or treated in remission, so to speak, has increased, right? So more people are affected by cancer, but there's more cancer survivors out there. And yeah, despite its ubiquity, we are still terrified of it.
Yeah.
I mean, and yet, so yeah, I think if we lived in a different world, I keep thinking that the way through there is one where we're more clear about, I mean, like you were saying, denial of death and our mortality is very alive and well, and in the 21st century. And so I think that plays a big part in it, why cancer itself is stigmatizing, as opposed to, there's other things that you can get that are troubling, but not necessarily as clearly associated with the potential to die, right?
Right. Anyway, it's a big question, a big thought. So I'm going to go back to the pre-submitted questions. One reads, are there stages of emotions after cancer like there are after a death? I think the question is, are there stages of emotion, just like when somebody has experienced a loved one's death and there's stages of the mourning period, I guess.
Yeah, like the denial and anger. Elizabeth Kubler-Ross's sort of that famous stages of death and dying, and when you're dying, and how that sort of thinking. So there's the problem with the stages idea is that it implicitly suggests there's one way or a right way to go through a life adversity. So that's one way of thinking about that. But on the other side, it actually can sometimes be useful to think about your experience in relation, so kind of in reference to the stages, not that you have to necessarily replicate them yourself, but at least it can give you a vocabulary to apply to your own experience. And I think if anyone is taking something away from this conversation, I do think a lot about being able to have the words to put words to your experience, be that labeling a feeling or in some other ways thinking about it. It can help put it in its place, so to speak, and make these challenging feelings and experiences more manageable. So on the other side, it is sometimes useful to have a vocabulary and to apply to your experience. And these stage ideas do give us that death, denial, or sorry, what was the original? Denial, anger, acceptance, bargaining, depression. it's important to take these with a grain of salt and pay attention to what resonates for yourself. But in general, there is, I would say, I'm going to be the stage person, there is commonly like the shock of the diagnosis. And then I do think, again, because most breast cancer patients are women, we all sort of click into that very constructive, instrumental, task-focused gear. That's what I think of as the mobilization stage, where you're just coping, getting through treatment, managing all your other responsibilities, putting one foot in front of the other. And it's not until treatment ends that you really get to kind of, you get this upswelling of feeling and uncertainty and all the ambiguity, that you didn't have, you wouldn't necessarily have felt as much of, because you were being told, this is the next step, this is the next step, this is the next step. And you were exercising those steps. And so I think that's a common, maybe it's not so much stages, but a cycle that folks can relate to, but it's broad brushstrokes, outlined for breast cancer. And of course, based on what we've been hearing today, how that gets filled in is very unique to the individual.
Okay. Another question. How do I deal with my medications that have caused depression?
Right. So again, this is the thing with side effects, right? Side effects are effects, whether you want them or not, and they're running in tandem or affecting us in tandem with the actual intended treatment or effect. And so I would direct folks, again, I was mentioning earlier, those amazing symptom management guides. First of all, I mean, Ontario Health Cancer Care Ontario has accessible online. But of course, I mean, because if you believe it's the medications that are responsible for the depression, like hormone suppression therapies, etc., I would definitely be raising this with your medical oncologist or your family doctor. There are certain antidepressants, for example, that can actually improve your mood, but also alleviate hot flashes in the same time. So again, speaking with a psychiatrist or the oncologist or your family doctor about ways to handle the side effects of your medications, that's one way. And of course, then there's a whole host of other ways to manage depression without having to take more medications. And I would direct you to, actually, here's a link I have here. And I'll post it to Bukun, who can post it to you. But again, there's the symptom management guide for depression, and again, multifold ways of handling the depression. It could be with anxiety medication or antidepressants. It could be with other resources. Okay,
Great. So Bakun, let's take some last few minutes with live questions.
For sure. So we have one on survivor's guilt. So again, I think that's one that many patients might be able to relate to. So she has a close friend who's going through the diagnosis at the same time, and that friend is now stage 4, and which is metastatic and terminal. So she's just wondering how best can she serve her, and she's dealing with like this survivor's guilt, which is really difficult to go through.
Yeah. I'm just pausing because I can really appreciate the dilemma, right? Yeah. You've been through it yourself. It's like your friend is living your worst fear, and yet this individual sounds like they're feeling strong enough in themselves to be of support, and instead is feeling this sense of a type of guilt. And so how do you, I mean, again, I guess I keep coming back to a bit of a broken record, but it's part of that whole rainbow of options feelings wise. You are feeling a degree of guilt. I mean, it is somewhat irrational, right? It is irrational. We all have a right to be here, or we wouldn't be here. So we have a right to be here, and yet your right to be here is not should not have any bearing on your friend, right? And so and yet it does. And so, I think just the first step is just recognizing that that's there for you. But I also hear in this question, you don't want that to interfere with your capacity to be present and be available to your friend who is going through a different process. And I appreciate comparing, the more open-ended sense of future that you might be experiencing with the more closed perspective that your friend is going through. It is stark. It is stark. But I appreciate it's not easy, but I also hear the intention to be available, and that's the priority for your friend. And so I'm not sure that's an answer to the question.
Yeah.
More of a comment of, yes, it's
Mhm.
true. And
Yeah.
yet maybe just affirming that there can be both going on. You have a right to survive this disease,
Yeah.
and so did your friend. But unfortunately, there's a whole element of this uncertainty we've been talking about, and chance,
Yeah.
and chance goes in many different ways for everyone. So
Yeah. So just acknowledging that, the difference that they feel is like justified and it makes sense. Yeah. And I know we've shared a lot of resources, and many of them are books. Do you have any resources that'd be like even something that, that person that asked that, like for caregivers, support person, things like that, any type of books and or like not books? Someone mentioned reading Worry Cure by Robert Leahy, but they find it hard to read. So just, any resources that are not books.
oh yeah, nothing is, sorry, I should say that if you go to those symptom management guides, they sound so clinical. I hate the language of symptom management, but if you go to the ones on anxiety, depression, and you click on them, there are actually some really interesting and good videos. Like there's one video that does that. I forget what it's called, but it's an animation. So it's really kind of captivating in that it's like line drawings, but it's about things you can do to manage your depression, for example. But it's really it's presented in a very accessible way. The other point you raise has to do with like caregivers, right?
Yeah.
And caregiver resources for
Yeah.
caregivers. And so again, there is a lot out there. I don't want to dissuade you from looking up those things. Like again, for folks who are caring for somebody who does have advanced cancer, there's always the Canadian Virtual Hospice, which is a gem of a resource in Canada that everyone should know about for carers. But of course, then for other, if you're going through treatment and you're looking to help and support, there's all those support groups I talked about.
Yeah.
For patients, there are the counterpart for caregivers, a lot of those as well.
Mhm.
The other thing I wanted to mention, again, I'm sure no stranger to Canadian Breast Cancer Network, but is Rethink Breast Cancer. That's intended for younger women. But again, they have some amazing resources for parenting during breast cancer and how to speak to children. And so again, I would encourage you to look on that website. Even if you're not necessarily consider yourself young, very educational, a lot of really great multimedia kind of presentations, some on sexual health and cancer and reclaiming sexuality after breast cancer, some on, as I mentioned, parenting during breast cancer of children of all ages and stages, not just young, but teens as well. So there's a lot available out there.
Yeah.
Too.
Perfect. So let's just end up with this last question, and I think it'll be helpful for everyone. So maybe like just a few tips and steps of like how people can start incorporating some of these things that you spoke about in their day-to-day basis, or just like checking in with their anxiety, practicing self-love, meditation. Is there any like one big one that you'd say, like, I guess your takeaway from like all that you've talked about, balancing and checking in with yourself and labeling your feelings? Like, what would you say is like, okay, this is something you can apply on your day-to-day basis and you'll see improvement, I guess?
Yeah, I really haven't, what I haven't stressed, but it's sort of here all the time, is breathing.
Mm,
So taking, some of the ideas that we discussed today, and when I talked about sort of doing that present moment, kind of recentering in the present, I would emphasize how integral the breath is to that.
mm,
And to do, there's like again, countless of ways, people who are very versed in coaching around this, but it's with you all the time, and it can be put to really good use. And the way to think about it is, as I understand it, is the inhalation is a nice deep breath that sort of fills your belly, and you can put your hand on your belly when you're in the area or anywhere watching TV. If it never occurs to you to draw your breath downward and make it a deep, full breath, but then as you exhale, let that breath be double the length, at least a little bit longer than the first.
mhm.
Oh, Kathy, where'd you go? Hope she wasn't trying to take a deep breath.
Oh, no, sorry. I'm just getting over a
No, of
flu.
course, no.
Go ahead.
Yeah.
I
So I
apologize.
guess that's one thing that I didn't emphasize, but it's like, I think of it as your breath is your best friend,
Yeah.
and it's with you all the time, and it never fails you until it does. We'll talk about that.
Yeah.
So, so to reconnect with that in whatever way, yoga is a great way, breath work through meditation, box breathing, where you envision a box and it's a rectangle. So as you inhale, up the one side, count to 4. Maybe it's not
Mhm.
quite a box, I'm going to make it some other shape, but then pause
Mhm.
for a moment or two, and then let exhale, but maybe make it a little bit longer. And then, so I would just, the one thing that I didn't stress in this conversation is the value of reconnecting with the breath. The other thing about the breath is that it is in the present moment. So by doing that, you're going away from the planning and the worrying, and you are just being in now, right in the moment. So that's just another piece I can't stress enough.
Mhm.
And it's something that is very accessible and always there for us to capitalize on.
Perfect.
That's a good way to end this session, especially since I tried to take a deep breath.
I know, how ironic.
Anyway, this has been fantastic. And this brings us to our session, to the closing of our session. Thank you, everyone, for your excellent questions and for joining us. Thank you very much, Dr. Fergus, for this great and engaging discussion. I'm sure everybody got a lot of information. And thank you to our participants for attending and all the great questions that you asked. After this session, you will be sent a survey to provide feedback on this session. Please fill out the survey, as your responses help us make these sessions better. Once again, thank you to our sponsors, Novartis, Pfizer, Viatris, AstraZeneca, and Roche, who all made this session possible. Thank you, everyone. Have a great day.